Athena eLearning presents the Affordable Care Act Individual Mandate. One of the most heated topics in America is the individual mandate to have health insurance as part of the Patient Protection and Affordable Care Act of 2010. Since the Supreme Court ruled on June 27, 2012, that the mandate was constitutional, much has been said on both sides of the issue, and many Americans are in the dark as to what the individual mandate means. Simply put, the individual mandate requires all Americans to have current minimum coverage health insurance. This idea is not new, nor is it exclusive to one political party. In 1989, the conservative Heritage Foundation conceived of requiring all citizens to purchase health insurance as an alternative to a single-payer system. Stuart Butler, an early supporter of the individual mandate at the Heritage Foundation, wrote, "If a young man wrecks his Porsche and has not had the foresight to obtain insurance, we may commiserate, but society feels no obligation to repair his car. But health care is different. If a man is struck down by a heart attack in the street, Americans will care for him whether or not he has insurance." In 1993, President Bill Clinton proposed a health care reform bill which included a mandate for all employers to provide health insurance to all employees through a regulated marketplace of health maintenance organizations. An individual health insurance mandate was enacted on a state level in Massachusetts. In 2006, Republican Governor Mitt Romney signed an individual mandate into law with strong bipartisan support. An individual mandate helps lower the cost of insurance by increasing the number of persons participating in the insurance pool. Insurance works by large numbers of people paying money, as premiums, into a single pool from which money, as benefits, is paid out as needed. The more healthy people paying in, and the fewer sick or injured people receiving benefits, the lower health insurance premiums will go. When fewer healthy people overall are paying for insurance, and the majority of those with insurance frequently require benefits, the costs of premiums rises in order to cover the benefits paid out. And even though healthy people may think health insurance is a waste of their money, it isn't. Though they may not need sickness care, they are still liable to have accidents and are still able to use wellness care and other benefits of their insurance plan to keep them healthy and to detect early warning signs of serious illness. Another significant reason behind the individual mandate is called the hidden tax. Families with health insurance pay an average of $1,017 per year to compensate for the uninsured. When medical care, usually emergency care, is given to those unable to pay, the cost is shifted to those with health coverage, either employer plans or individual family plans. Nearly $43 billion in unpaid medical costs was borne by those with medical insurance in 2009 alone. The individual mandate featured in the Affordable Care Act is to be phased in during the year 2014. As designed, the mandate will be fully implemented by 2016. The mandate requires all Americans to maintain minimum health insurance coverage for themselves and their families or face a penalty, with the following exceptions. Persons claiming a religious conscience exemption applies only to certain faiths. Incarcerated individuals, undocumented aliens, individuals who cannot afford coverage, example, those required contribution exceeds 8% of household income. Individuals with a coverage gap of less than 3 months, that is, those who have recently lost insurance coverage. Individuals in a hardship situation, as defined by the Secretary of Department of Health and Human Services. Individuals with income below the tax filing threshold, and members of Indian tribes. The minimum mandated coverage includes the following types of health care in common use today. Government-sponsored programs including Medicare, Medicaid, Children's Health Insurance Program coverage, TRICARE, coverage through Veterans Affairs, and health care for Peace Corps volunteers. Employer-sponsored plans, including governmental plans, grandfathered plans, and other plans offered in the small or large group market. Individual market plans, including grandfathered plans. And other coverage designated as minimum essential coverage by HHS and/or the Department of Treasury. The penalty for not having minimum essential coverage will be the greater of a flat dollar amount per individual or a percentage of the individual's taxable income. For any dependent under the age of 18, the penalty is 1/2 of the individual amount. The flat dollar amount per individual is $95 in 2014, $325 in 2015, and $695 in 2016. After 2016, the flat dollar amount is indexed to inflation. The flat dollar penalty is capped at 300% of the flat dollar amount. For example, a family of 3 with 2 parents and 1 child under 18 would have a flat dollar penalty of $1,737 in 2016. Whereas a family of 4 with 2 parents and 2 children over 18 would have a flat dollar penalty of $2,085 in 2016 because the 300% cap would apply. The percentage penalty is based on the individual's taxable income, phased in at 1% penalty in 2014, 2% in 2015, and 2.5% in 2016. If an individual has a household income of $50,000, the percentage would be 1% of the difference between $50,000 and the tax threshold. Assuming the tax threshold is $10,000 in 2014, this individual would be subject to a percentage penalty of $400. Because this percentage penalty is greater than the flat dollar penalty for 2014, which is $95, he would pay the percentage penalty. Generally, the annual penalty is capped at an amount equal to the national average premium for qualified health plans which have a bronze level of coverage available through the state exchange. And it is important to note the penalty paid for not maintaining health insurance will be used to offset the cost to taxpayers to care for uninsured Americans. The penalty for failure to maintain insurance will be paid as a federal tax liability on income tax returns and is enforced by the Treasury. Individuals that fail to pay the penalty will not be subject to criminal penalties, liens, or levies. The Affordable Care Act is also working to keep Americans insured and to insure more Americans by offering a tax credit of up to 35% of small business health insurance costs, increasing to 50% in 2014. And in 2014, Medicaid will be expanded to include more Americans, providing greater access to health care. And the individual mandate can be waived in states that have decided to opt out of the Medicaid expansion. So individuals can apply for a waiver where their income is low and Medicaid is being blocked by their state government. To summarize the individual mandate. 1. The mandate is not a tax to fund the Affordable Care Act. The only tax is the penalty for failing to purchase health insurance by those who can afford to. And that penalty will be added as a tax liability. 2. Penalties for failure to maintain health insurance will be used to help offset the costs of caring for uninsured Americans. 3. Exemptions to the individual mandate exist, and waivers may be obtained by those in states that refuse the Medicaid expansion. 4. No one will be required to change their existing insurance because of the individual mandate. 5. Individual mandates were originally proposed by a conservative institute, first enacted by a Republican governor at a state level with strong bipartisan support, and unanimously voted in by Democrats in Congress and signed by a Democrat president. 6. The individual mandate is part of a larger act designed to promote personal responsibility, improve the state of medical care, keep more Americans healthy and working, increase the job market, help small businesses and entrepreneurs afford insurance, and strengthen the United States and world economies.